I'm Dr. Miles Graivier at the Graivier Center for Plastic Surgery. Now, Jim is interesting, of course, because he has a bit of a C-shaped deformity that you can see in the dorsum of his nose and a deviated septum, but he doesn't want any surgery right now. What we're going to do is we're going to correct his supratip because, again, he has a little bit of this asymmetry coming down this little C shape. And we're going to come and correct a little that supratip moving down a little bit into his tip in this area. So we're going to give him essentially a straightened nasal dorsum, so we're going to camouflage this C shape and also going to balance out his lower lateral cartilages at his dome a little bit more. And we're also going to fill in the ala underneath that skin graft. A lot of times when we do this, as I said, you can get structural support. And when we add the support underneath this graft itself, the old graft, which was done I think about 3 or 4 years ago, we're actually going to probably see this ala open up a little bit. The nose can be a little sensitive, again, just topical. And I know I'm down beneath the dermis. We always want to do that. And I'm going very slowly, very low pressure. And we're going to start to bring out this left supratip. Again, what it's going to do is kind of balance our C-shaped deformity. It's going to camouflage that. The nose doesn't take a lot of volume in general, but as I said, as a safety measure, it's something that you can bring someone back every month and do a little adjusting if necessary. But I've also found that product lasts for a long time, anywhere from 18 months to 2 or 3 years in the nose. I'm telling you, that really is, that's pretty dramatic, I will say. Even with a very small amount, I've used 0.3 cc so far. And I'm going to go down and see if I can't, again, get a little more support, a little more opening underneath the graft and at the ala. We're going real slow. And interesting enough, like I said, you can use this under grafts. Just had to be very conservative with it. I'm watching for blanching, very low pressure. You know, it's really a nice tool. We can put this, of course, in the columella and the radix, in the dorsum. Now look how much we've camouflaged that C shape on the dorsum, is really smooth and straightened it out so that it takes away that appearance. And underneath the graft and underneath the ala, actually we've supported it, I think, pretty nicely. Let me get you to look back now for a second. And you can actually see that that side is opened up, which kind of, again, is counterintuitive. But by putting that lifting volume in from the injection, I think that's really, it will help open them up and give support to that ala, and that stays. We end up using 0.8 cc's total, where I used 0.5 cc's along this supratip and lateral dorsum, a little bit in the left lobule, and then 0.3 cc's in the ala and underneath the graft. I'm going to get you to kind of see that the contour is really good. And I think when the swelling goes out, we're going to be very, very much more even.